Thanks for joining us here on Good Day Chicago. Northwestern Medicine has launched a new program to support people with obesity who are planning a pregnancy. It is called the Pearl Program and not only includes counseling on healthy weight loss, but also targets the obstacles these patients face when trying to conceive. And Dr. Christina Boots, a reproductive endocrinology and infertility specialist at Northwestern, joins us now. What a title. It's a long name. But
it's a long name.
So important.
Yes, yeah.
So, Dr. Boots, tell me a little bit about this clinic and why you decided to launch it.
Yeah, well, it comes because my colleagues and I who started this program have been seeing and taking care of patients who struggle with weight and obesity for a long time and done a lot of research on it. And as we understand weight and obesity and the role it plays on both fertility outcomes and pregnancy outcomes, it's complicated. And I think for general OBGYNs and primary care doctors to have the time to really invest and digest all of that information is hard. And so we're increasingly seeing more patients who come to us and say, hey, I want to be healthy. I would like to start building my family, but I want to be as healthy as I can be. And so there's a lot of stigma in healthcare and weight, and we really wanted to take that information that's out there and individualize it for the patients in a very sensitive and thoughtful way.
So who is the perfect patient for this clinic then?
Yeah, it's patients who are struggling with their weight, so they're in bigger bodies and have a high body mass index, who want to do just that and say, I want to improve my health. And so we have this multidisciplinary clinic, which means that we have myself as a reproductive endocrinologist and infertility specialist, which is a long-winded way to say a fertility doctor. But we have a maternal fetal specialist, which means that she helps with high-risk pregnancies, a weight loss specialist, and then as well as dietitians and mental health support. So a really well-rounded team to talk to these patients and say, you're somebody who I think would benefit from weight loss, or maybe not.
So what types of challenges do these patients face trying to conceive, and also once they do conceive?
So we know that BMI, or body mass index, is an oversimplification of health. So that in of itself doesn't mean that you're going to have problems, but we know it makes you higher risk. And so women in higher body in bigger bodies will often have more ovulation dysfunction or irregular cycles, which can lead to delayed conception. They can also have higher risk for other metabolic diseases like diabetes and high blood pressure. And these are things, or thyroid dysfunction, things that we can fix and optimize before trying to get pregnant. And then certainly once we are pregnant, we see higher rates of those conditions in the pregnancy and other things like preeclampsia and preterm delivery.
Gotcha. I think it's so important to share our story, because someone may hear it and think, oh, you know what? That's a good idea. And so, you know, people know about my challenges with infertility and how I went through IVF so that we could conceive our daughter. And I had my thyroid was all out of whack. And so I didn't know that, even though I'd always gotten my yearly physical, until we walked this path. And so it really is so important to work with someone who knows all the details. The last question for you I have is, oh gosh, there's so much talk about these weight loss medications. Are they safe for someone to take while pregnant or trying to get pregnant?
Definitely not safe to be on weight loss medications while you're pregnant. While you're trying to grow a baby is not a good time to restrict our calories. But there are a lot of patients who will benefit from being on them ahead of time. And I think really individualizing, taking the time to have meaningful but safe weight loss prior to pregnancy, and then deciding how and when to stop those medications and how to optimize and avoid weight regain afterwards is really important. And so seeing somebody who specializes in that and is really thoughtful and caring is really important.
Dr. Boots, thank you so very much for all of your knowledge this morning.
Thank you for having us. It's important.